Hello, good afternoon, good morning, and good evening. Thanks to everyone who is joining our today's live Q&A on mental health. My name is Alexandra Kuzmanovic, and I'm very, very pleased to wish you a happy World Mental Health Day on behalf of WHO. We will have various guests today, more than usual, who will be joining us from different places around the world. And they will be answering your questions about mental health, but also Sport for Health initiatives that we are partnering with the Ministry of Health of Qatar, FIFA, and others to raise awareness on mental health well-being around the world. So before we start getting your questions, maybe I will introduce the first guest, who is Dr. Mark van Ommeren, who is our Head of Mental Health Unit in WHO headquarters. So Mark, good afternoon. And maybe you can start by telling our viewers, why are we marking World Mental Health Day every year and how big this health problem is?
Thank you so much for giving it time and attention to mental health. World Mental Health Day is organized every year to give attention to mental health, which is a hidden issue in society. Largely, it's much more common than we think. Mental health problems are common, they're disabling and largely undertreated. Our estimates are that 1 in 8 people in the world has a mental health condition. That's a much higher number than most people would imagine. There's no community without many people in it with mental health difficulties. 1 in 100 people, out of every 100 deaths, 1 is by suicide. Suicide is also much more common than we often realize. And only 1 in 3 people in the world with either depression or psychosis is receiving services. So all of that shows it's an enormous problem, and World Mental Health Day every year gives attention to that. Thank you for your question.
Thank you so much, Mark. And I'm already seeing that our viewers are sending us questions. So we'll get back to your questions, in particular about mental health care and what each of us can do either for ourselves or for the people we love and care about. For those who are not yet familiar how to send their questions, if you're watching us on Twitter, please use the hashtag AskWHO. If you're watching us on Facebook, please use the comment section and I will pass the questions to our guests. I think I will move now to Qatar, where we have 2 guests from Ministry of Public Health who are sitting on some different benches than the rest of us in this conversation. So Dr. Ian Tilly and Dr. Samia Ahmed Abdullah, who are working on a national strategy at the Ministry for Mental Health and Wellbeing. Good afternoon to you in Doha.
Good afternoon. Salam alaikum.
Thank you so much for joining us today. And maybe you can tell us a bit more about those special benches you are sitting at today.
Okay, thank you, Alexander. And it's a pleasure to be here on World Mental Health Day, sharing some of our experiences. As Mark said at the start, the mental health affects many people across the world. And one of the greatest impediments to accessing mental health services is the stigma that surrounds mental health. And one of the things that we are trying to do in Qatar, and we hope through this broadcast around the world, is to talk about the importance of bringing physical and mental health together in order to eradicate the stigma that prevents people from seeking help. So the bench that Dr. Samia and I are on are one of 32 benches that will be launched during the FIFA World Cup. And I'm delighted that FIFA have taken a lead in talking about mental health and in stressing the importance of good physical and mental health. So our bench is a celebration of World Mental Health Day and an opportunity to raise awareness about mental health across the world, we hope. Dr. Samia.
Dr. Samia, I apologize, we don't hear you very well. Maybe our colleagues can help with your sound. We still can't hear you, Dr. Samia, but maybe we'll give a minute or 2 to our colleagues to fix the sound in Doha. Meanwhile, friendship benches are also a symbol of what we would like to encourage around the world, for people to reach out to someone they trust and talk, or for others to offer help. So I think I will now introduce our next guest, Dalia Achiever, who is international football player and also a mental health advocate for a Reach Out campaign that FIFA and WHO have been working on since before we joined forces for the upcoming World Cup. So Dalia, good morning to you. You're joining us from Canada, and maybe you can tell us a bit more about the Reach Out campaign and what is your motivation to be an advocate for it?
Hi, good morning. So mental health for me, has always been very important, and mental health and well-being has never been more important to talk about and introduce as a whole. So Reach Out campaign is a campaign to raise awareness of symptoms of mental health problems and encourage people to seek help. So therefore, FIFA wants to support everyone who is vulnerable to or suffer from mental health problems, and calls on everyone to look after and look for people around them. FIFA Under-17 Women's World Cup is supposed to commence on Tuesday, October 11th. Therefore, it is important to create awareness about mental health in young audiences. Reach Out campaign will be featured all throughout the tournament on pitch side signage at every game. Therefore, FIFA feels that FIFA legends as well can serve as very authentic role models in terms of promoting mental health. For me personally, I have been involved in mental health in the field of sports psychology for a while. I am doing my master's in sports psychology, and my research is focused on mental health in elite soccer players. So for me, I come from personal experiences as well as the research and the ignorance that mental health has been getting in athletes. So therefore, we feel like a worldwide stage like a FIFA World Cup serves as a very good platform to be able to promote and create more awareness about mental health in sports.
Thank you so much, Dalia, for being with us today. We look forward to hearing more from your work and experiences. And last but not least is our expert, Dr. Khalid Saeed, who is a mental health advisor in our office for Eastern Mediterranean region. Dr. Khalid, maybe you can tell us a bit more about WHO's work with the government of Qatar and also FIFA on Sport for Health initiative, and how sport can be beneficial for mental health.
Thank you very much. I think the previous speaker, made a very important point that now more than ever, mental health is important. And COVID-19 pandemic has shown us that it is not just about a few disorders. It's about who we are, how we live, how we communicate, how we relate to each other, and how we work. So as long as we keep that in mind, that mental health actually defines who I am as an individual, as part of the community and the world at large, then every one of us has a role to play. And that is what we have been sort of trying to work with when it comes to working with Qatar specifically on the range of issues, not just about a few disorders. Obviously, issues of stigma, discrimination, lack of access to mental health services, those are the issues we are working with in Qatar. And this current initiative of using or partnering with FIFA, using the platform of World Cup to raise awareness about mental health in general and to advocate that it is not just one-off event, but going forward it is a legacy which is to be there to make sure that mental health stays as part of the conversation throughout the next years. So that is one thing. The second issue which you talked about was about sports and mental health. Now, if you look at sports in general, not necessarily, I'm not talking about highly competitive sports. Anyone who engages in sports every day, you can feel the benefit of it immediately in terms of physical well-being as well as mental well-being. And the reason is both biological as well as psychological. Because once you are engaged in sports, you are concentrating, you are in the moment. And that's the whole issue which we talk about mindfulness. And so that's how it can help psychologically. Physically, there are a number of hormones and neurotransmitters which are being released, which help as well. But also, when we engage in sports, we also tend to link with people. We link with our colleagues, link with our friends, link with our community. And when we engage in competitive sports, you would see that it brings a lot of people together in the country, in the community, in the neighborhoods. So that is again something which contributes towards positive mental health at the same time. And then last but not the least, the fact remains that people who engage in sport also tend to engage in other healthy behaviors. I mean, they would avoid smoking, they would focus on their nutrition, take care of their self in general. So I think sports is a multi sort of ferrous kind of mechanism through which we can work on mental health.
Thank you so much, Dr. Khaled. Mark, we are already receiving some questions from our viewers, and the one is about COVID-19 pandemic impact on mental health. So we also issued a report earlier this year that did release some data since the pandemic and the increase in mental health conditions since this virus entered the world.
Yes, well, COVID-19 pandemic has obviously been very hard on many people, particularly people who are more vulnerable in society. The overall rates, by our best estimates, and there have been so many studies, but if you put them all together, the best estimates are that the rates of depression and anxiety have gone up by 25%, which is enormous. Thankfully, suicide rates, as far as we can tell, have not gone up, which is great. But the data on suicide always come in late, so maybe we have to monitor this for over time. But it's not. What's bad news is that people with severe mental health conditions were hardest hit by the pandemic. They were more likely to get infected, and they were more likely to die once they got infected. So overall, the impact of the pandemic has been hard, and that's why it's so important to prioritize mental health right now. Right now, when the interest in mental health is very, very high, it's really important that whoever invests in mental health to invest more, to give it more value, to commit deeper to progress in the developing services and making society safer from protect people from mental health problems.
Thank you so much, Mark. I think we got the sound sorted back in Doha. So looking into this new data showing how also COVID pandemic impacted and increased mental health needs around the world, I'll go back to Dr. Ian and Dr. Samia to tell us more about the Are You OK campaign and how the visitors in Doha could find the benches once they are there. Dr. Samia, I do apologize, but we don't hear you again. How the visitors in Doha could find the benches once they are there. Dr. Samia, I do apologize. We don't hear them again. We apologize for that. Dalia, maybe you can offer some advice from your work and personal experience. If someone we care about is struggling and need help, how a person can offer a help? Or on the other side, if someone is in need to talk to someone and seek help, what would be the best way to do that? You are muted. We apologize. We don't hear you.
Okay, can you hear me now?
Yes, we can hear you. Thank you.
Okay, all right. So I feel like the first step to seek help or make sure that somebody who you care about or somebody around you gets help is to reach out, to ask for help. And after that first step, if you think there's somebody else that needs help in reference to mental health, you can help them get in touch with people, mental health specialists or like counselors, in order to get them help. Or like if it's you, it's important that we reach out, that we talk about it, because it is only human to feel what we feel. It is only human to experience the way we feel and our emotions in given situations, and it is okay to acknowledge that. So I feel like to be able to reflect onto how you've been feeling and to be able to feel better, it is very important to reach out and seek help. And when you reach out and seek help, make sure you have contacts to like help the other people as well in given situations, and it is okay to acknowledge that.
Thank you so much.
So
I think we are
like
hearing sound back from Doha. So maybe we can give a chance to Dr. Ian and Dr. Samia once again.
And seek help. And when you reach out and seek help, make sure you have contacts to like help the other people as well in given situations, and it is okay to acknowledge that. So I feel like
we are hearing the delay. So maybe we can give a chance to Dr. Ian and Dr. Samia once again.
And seek help. And when you reach out and seek help, make sure you have.
Hello? Do we have Doha on the line? I apologize. We probably have lost Doha, unfortunately, and the sound from the benches. I will go back to Dr. Mark and Dr. Khalid, passing on questions from our viewers then. Mark, maybe we can start with you on this one. Our viewer, Kiplangat Buzeki, is asking, what measures has WHO put in place to ensure mental health patients are attended to without having to pay highly for services? This is a part of our work and advocacy for health for all and universal health coverage, and of course mental health needs to be part of it.
Well, WHO, one of the key messages from WHO over the last number of years is universal health coverage, which means that anybody should have access to affordable, effective health care. And a key message also from us is that mental health should be part of that. So WHO's recommendation to governments is to include mental health in all benefit packages, in all insurances, just like at parity with, just like physical health conditions. Now, in addition, WHO spends a considerable amount of effort to increase the commitment for mental health, like being part of this event, to make sure to ensure that we value mental health more and commit more to mental health. Also, we are working a lot, advising governments, advising civil society agencies, NGOs, on how to provide better mental health care and how to do that near where people are and effective quality care.
Thank you so much, Mark. And here is another question from Tony Chibwana. Maybe Dr. Khalid, you can take this one. He's watching us from Malawi and asking, what are some of the major causes of mental health disorders?
Well, I think like all chronic diseases, there is no single cause of mental health problems. Mental health problems are multifactorial. It has some genetic and biological contribution. It has social and psychological contributions. So the determinants of mental health would include where we are born, in which conditions we are born, how we are raised, what kind of socialization, schooling, and the other experiences we have in the community. All of these have a bearing. But at the same time, we also need to remember that issues like nutrition, issues like vaccination, issues like good schooling, having opportunities for jobs and good trainings. All of these have implications for mental health. Similarly, having adverse experiences, whether at an individual level, like having maltreatment or abuse, whether it is physical, emotional, or psychological or sexual, has implications for mental health. But at the same time, good parenting and good bonding and attachment with the caregivers also has positive impact, which lasts well into adolescence. So, as I said, that it's not one thing or the other, it's a mix of biological factors, that is the genetics, and the other factors like chronic diseases or nutrition and so on, but also psychological and social factors. And that's why it's important that we cannot say that mental health is the issue to be addressed by mental health personnel or mental health specialists. It is just too important to be left to mental health specialists alone. We need to make sure that everyone in the government and everyone in the society is engaged and allowed and willing to play their role to promote mental health, prevent mental health disorders, and at the same time make sure that people who do have mental health problems get good quality humane care.
Thank you so much. And here is a follow-up question from Nirasha Patriana. Does malnutrition impact mental health? Dr. Khalid, if maybe you can address.
Certainly. I mean, lots of factors, as the children, particularly I assume that he's talking about malnutrition, particularly in case of children. And we are seeing that a lot in number of countries in the Eastern Mediterranean region, for example. I mean, you look at Yemen or Somalia and so on. Malnutrition, like lots of other factors, would have an impact on the cognitive, social, emotional, and language development of the child. So that's why it's extremely important that when we are talking about mental health, we should not neglect the fact that number of physical factors have impact on mental health. So proper nutrition is extremely important for the development of the child. But at the same time, we also need to be aware that the other end of the spectrum, where people tend to eat unhealthy food, tend to gain weight, do not engage in physical activity, that also has implications for mental health, particularly when it comes to adolescents and young adults.
Thank you so much, Dr. Khalid. We have a follow-up comment to what we were talking to Dalia just a few minutes ago. And Katrin Koe is saying that it's not always easy to reach out and ask for help. So maybe we can give some more advice if people are not feeling comfortable or feeling fear, how they can overcome and reach out for help. Dalia, would you like to say more about that?
Yeah, for sure. I think helping with mental health starts not only by the person who's experiencing it, but also like the people around them being aware and creating more awareness. I think for what stops people to reach out is being comfortable. So I think like when people around them are more aware and we try to we try to create awareness about mental health, people are going to be comfortable in terms of reaching out. And also if you do experience any signs or symptoms of anybody experiencing mental health problems, or you think there could be that the person could need help, it is very important that you make them feel comfortable, you try to talk to them. And also you don't have to start to explain what is it exactly that you're experiencing, just like by a simple question of like how they're doing today or how was your day. I feel like just trying to make the person feel at ease and trying to make that person comfortable, or trying to develop a trustworthy relationship. And I feel like I remember one of the speakers highlighting the importance of good parenting and a good parenting, or like, you know, having good relationship with friends, and how that can help with mental health. And I feel like friends and people around the family play a big role in that as well. So like, you know, just making sure that people around you are doing okay. And if you experience any signs and symptoms, just making sure and asking them and trying to make them comfortable that it's okay. And like, you know, like mental health is something that a lot of people, mental health problems is something that a lot of people experience. And yes, like, you know, all of us live in a society that is very stigmatized in terms of mental health, and it's not always very easy. But like, you know, a small step, like, you know, making sure, or just asking how a person is doing in case you notice anything, and just like I said before about creating awareness, it makes people feel more comfortable.
Thank you so much, Dalia. And speaking again about encouragement and making people comfortable to reach out and seek help, I will try to go back to Doha and Qatar, where we have our colleagues from Ministry of Public Health of Qatar, where we launched today those friendship benches that are a symbol of encouragement for people to seek help. So Dr. Ian and Dr. Samia, I hope you hear us now and that we will hear you back. So can you tell us a bit more about these benches and Are You Okay campaign? And when the World Cup starts, how can fans and visitors to Doha find their benches?
Yeah, we can speak about our campaign, and the whole idea of this campaign is awareness of mental health. As we mentioned by my colleague, mental health, there is no health, and it's important to raise awareness in the community and to create in the community. For example, our UK campaign is connected. For example, you can ask me in the office, you can ask any member in the family. I will say, so this will open the gate. He can talk more openly. He can talk more openly about his feelings. He's anxious, he's depressed.
I apologize, Dr. Samia. We hear you, but we have difficulty understanding. Can we maybe try Dr. Ian's microphone if we could hear him better?
Yes.
Okay, so I mean, to recap what Dr. Samia was saying, the Are You Okay campaign is just an opportunity for us to ask someone how they're feeling. The previous speaker spoke about it being difficult to voice a view about how one feels. I mean, just reaching out and saying, "Are you okay?" gives an opportunity for people to start that conversation. And in terms of the benches, it is about reaching out. But what we want to do is reach as many people as we can and make it much easier just to talk about mental health. We've talked about the stigma, we've talked about the difficulties people have, and the experience we've got in Qatar is by going that extra mile just to ask someone, "Are you okay?" seems to impact. And we've been very fortunate in opening a national mental health line in Qatar between Hamad Medical Corporation and the Primary Healthcare Corporation to give people that easy access. And just by inviting people to overcome that initial barrier and seek help has made huge improvements to people's lives.
Thank you so much, Dr. Ian. And maybe we've been receiving questions about mental health care and access to mental health care in different countries. Maybe you can tell us from Qatar's perspective what your country has been doing to improve access to healthcare for people living in Qatar.
Yeah, can you hear me? Access is really a priority. Access to mental health is really a priority in Qatar, and we are committed to implement the national mental health strategy. So therefore, we open and we expand services in primary care, so people can reach mental health services very easily.
I do apologize. We really have, again, difficulty hearing you.
Yeah. Again, I will give it to Ian.
Thank you.
Is this better?
Yes, we hear you loud and clear. I don't know why we can't hear Dr. Samia, but we hear you very loud and clear.
Okay. Actually, again, what Dr. Samia was saying is there's various points of access in the country. We've got three major objectives in mental health: improve access, reduce stigma, and integrate care. And having access to mental health services within primary care has actually made it much easier for people to access services in non-stigmatized services. And as I mentioned, the helpline as well. So our services are about easy access at the front, so through the helpline and through primary health care, and then integrated care where possible within hospital services. So we've made a great deal of effort to ensure our services are normalised and are not seen as sort of separate mental health services, but rather integrated with other parts of the health system. Primary care is the key part to that access point.
Thank you so much for being with us. I will take another question from Nikki Snow. It is again on what Dalia was speaking, and Mark, maybe you can complement with some of the WHO recommendations. How will you make someone to open up about their feelings without making them feel pressured or scared? A lot of interest in opening up and encouraging people to open up today.
Okay, that's a good question. The question is actually whether you must make people open up. It's very good for people to it can be very good for people to open up, but sometimes people are not ready to open up. So what is really helpful is you can create the space for opening up by being available, making sure there's moments of time where the person has opportunity to express themselves. But you cannot push someone to open up who doesn't want to be opened up, and it's actually unhelpful. So just being available, to showing that you care, and proving that you're trustworthy enough for them to open up to you is really important.
Thank you so much, Mark. We have a question from Noel Walter, and maybe Dr. Khalid, you can take this one. Noel says that mental health is a new phenomenon. So many people are struggling with mental health, with mental issues, and need immediate help. Maybe we can clarify that mental health is not a new phenomenon, but maybe this is the result actually of stronger advocacy and awareness efforts around the world. So I will take this as a positive feedback that we are doing better in educating people about the importance of mental health. Dr. Khalid, would you maybe explain?
I'm sorry, I didn't catch all of.
Apologies. So
yeah, I'm sorry, I couldn't catch all. I think what I got was that mental health is a new issue.
Yes, so maybe we can clarify that, because one of our viewers is saying that mental health is a new phenomenon and more people are suffering from it now.
Yeah, I think it's important to remember that the definition of health is that physical, social, and psychological or mental well-being, not the absence of disease. And that has been there for more than 70 years. So mental health per se is not a new phenomenon. What I can understand is that in the last few years, more attention has been sort of given to the issue of mental health. And COVID-19 is a perfect example that it has brought the conversation to the highest levels. And now everyone is aware of it and everyone is talking about it. And why we are sitting here and what we are doing now is another example that we are now able to talk about it more openly. And I think that is something which is the key development, and that might be the reason why this particular question is coming through. And secondly, I think it's also extremely important to highlight that traditionally there have been strengths and mechanisms in the society which allowed people to talk to each other, have time for each other. And if you just remember that most of the time, the first person you seek help from is often within your own community, your elders, your relatives, your friends, and so on. So I think we should not forget the role of that particular resource. And for me, the friendship bench actually is a reiteration of that particular resource, which we should keep on sort of highlighting and maybe build upon. rather than just focusing on the role of mental health specialists. So this role, this resource in the community, which is there, and Friendship Bank probably is going to bring that back for me, is something which is worth highlighting as well.
Thank you so much. And Dalia, here is, I think, very good question for you coming from Vanessa Martinez Lagunas. What strategies can help in high performance sport to athletes and coaches to take care of their mental health?
Yeah, I feel like in sports, and especially when it comes to like high performance environments, there's not one but various techniques. And I feel one of the major things or like strategies that even I use as a high performance athlete is breathing exercises, because a lot of times before a game and even like competitive environment is very demanding. It's an ever changing it's an ever-changing field. It's very dynamic and it's very, very demanding on athletes, where you put on a spotlight and you're supposed to perform, and winning is the priority. Therefore, it can place a lot of demands on athlete and on coaches to get those performances and get those results. And in that, we fail to realize that how sports is not just about winning, and winning and losing is a part of it, but it's about coming together, meeting new people, making new relations, and trying to perform at the best of your ability, where winning and losing is going to be a part of it. So I feel like simple exercises like simple breathing exercises are a big strategy that I use to calm myself down, to make myself focus. And I think it has been research shows that how breathing exercises, meditation, and even sitting before a game, or when you're by yourself and you're in the bus, or when you're in your room, just imagery and thinking about the scenarios and how you could work through different scenarios if you were put in a situation, that seems to help. So I would say there's not one, but there are various strategies like breathing exercises, meditations, or even just writing about your best game. And I think one of the strategies that has really helped me as a high performance athlete, when I'm feeling very nervous, or when I fail to believe in myself that I can perform at my best, or that I'm capable of doing what is required of me on the field or in a given task, I try to write down a few of my best performances from the past. And whenever I feel that or I doubt myself that I wouldn't be able to do it, or I'm very nervous, I try to go through that entire scenario or of my best performance, and it helps me remind the simple things, and it helps me reinstate the belief in myself, what I'm capable of. So again, coming back that there's not one but various strategies. And for coaches and for athletes, you need to you need to see what works best for you, because there's not one technique that works best for everyone. So you need to work through different techniques. You need to find out what works best for you, and then try and make it a regular part of your routine, or try to go through those activities once in a while, so that you're able to reflect on your feelings and emotions, and you're able to reflect on how you're feeling and what is required of you in a given task.
Thank you so much, Dalia. You were talking about meditation, breathing exercise. One of our viewers was asking, is yoga helpful for mental health wellness? Do you ever do yoga, or do you think it can also help?
Yes, definitely. I do yoga. Yoga is a part of my mobility regime as an athlete. For me, mobility is very essential. And I feel when we do yoga, it's not only just about the physicality and the mobility and the flexibility that it provides, but it also helps to calm down your nerves. It helps you bring have a control over your heart rate, your breathing. So I feel in general, yes, yoga is very helpful, because when you're going through movements, when you're holding certain postures, it helps you. It kind of brings your focus on what you're doing in the task at hand, where you're able to compartmentalize your thoughts and your feelings. And I feel like when you're going through the movement or the asanas, it helps you focus on what you're doing, and it helps you get a control back of your breathing and of your movements and of your body in general. So definitely, like, yoga does help physically as well as psychologically, and and mentally as well, like trying to have a control over your body as you go through the asanas. And again, like, yoga does include a lot of breathing exercises and breathing patterns. So I feel like, again, that in turn as well, helps a lot with the mental health.
Thank you so much, Dalia. This was really helpful and very practical first-hand advice. Thank you so much for that. I think we will go back to Doha because sadly, with those technical problems, viewers could not hear Dr. Ian and Samia, but they're actually very interested. We are receiving questions. What's the meaning of friendship benches and how they will be used during the World Cup in Qatar? So this is coming back from viewers who weren't able to hear you. So I hope we can give it a try again.
Okay, can you hear us now?
We hear you very well, loud and clear.
Oh, excellent. So the background to the friendship bench, so there was a tradition in Qatar many years ago where the elder in a household would sit on a bench outside of his or her house. And if a person was passing and looked in distress, that elder would simply invite them to sit with them, and they would talk about how they felt. And in Qatar, we adopted a similar process when there was a man in Zimbabwe who built the first friendship bench to represent mental health. And through the Wish Foundation here in Qatar, we adopted that friendship bench. And what we've done for the World Cup is we've used a partnership between the Ministry of Public Health, the WHO and FIFA to create friendship benches that symbolise the importance of reaching out for help if you need it, but also asking people, are you okay? So we're using the friendship bench as a symbol of friendship and an opportunity for people to start a dialogue about mental health. And we hope that that will raise awareness here in Doha, but also raise awareness across the world on the back of the World Cup.
Thank you so much. And can you tell us how the benches will be used during the World Cup? Where can fans and visitors find them?
So currently we have 12 of the benches outside the 974 Stadium, which is one of the World Cup stadiums here in Qatar. There will be 8 World Cup stadiums, and the benches will be distributed across fan zones and the stadiums themselves. And what we hope to do during and after the World Cup is encourage people to find the benches so that we mix physical activity with mental health. So we can encourage people to walk and to sit, and we can encourage people to sit and to talk. So they'll be distributed across the country during the World Cup and then located in other locations after the World Cup.
Thank you so much, Dr. Ian. And you've been working with WHO beyond World Cup on sport for health legacy. So what are the plans for future, and where does this idea come from? Why sport and health?
Sport and health. So the Sport and Health Partnership was an initiative that WHO and FIFA spoke with our Ministry of Public Health about, and we saw that as a great opportunity just to encourage physical health care. So we want the World Cup to represent a healthy tournament. We want people to engage in healthy activity, both physical and mental. So I think having the partnership between WHO, FIFA and the Ministry of Public Health has actually helped us to celebrate health in a much wider way.
Thank you so much for joining us. We are very sorry that we had these sound troubles, but thank you for joining from in front of the stadium and benches, for showing our viewers how the benches look like. And we hope as well that this will not only have fans in Qatar, but also friends and around the world to open up and seek help from their loved ones. We have a few more questions before we close, I would say. And one is coming from Nader Abrahim, who says that one of the most important ideas in mental health is the idea that it's a continuum, not an on and off button. You can be free of mental disorders and still have lots of area for development. Mark, maybe you can start answering this question before we close.
Well, this is absolutely true. all of us can improve on our mental health, which means to cope better with hardship and to be psychologically healthier so we can perform better in our lives. And even people with mental health conditions can still have positive mental health. Just like someone who has a physical illness can have that physical illness, but maybe healthy in many other ways, physically healthy in many other ways. So absolutely, it's a continuum, and it's good to think about it that way. Yes.
Thank you so much. And maybe before we close, Dr. Khalid, what would be your advice that you would give people to support their mental health?
I think, first of all, as I said earlier, that for me, mental health is what defines who we are as individuals, as communities, as nations. So we cannot leave it to mental health professionals alone. We need to have everybody join hand to promote mental health and to prevent mental health problems and help people who do have mental health problems live more satisfying and productive lives.
Thank you so much. Dalia, what would be your closing message for our viewers, how to maintain mental health well-being?
For me, my biggest advice would be to create awareness, whether it is from educators, whether it is from the coaches, whether it is for everybody around, whether it is in families, to talk about mental health and make it a part of our conversation and not treat it as something that does not exist. For far too long, as in general, we've been ignorant about mental health. So I feel like my advice would be to make it a part of our conversation, to highlight it, and to make space for people to come out and to talk, and ideas like friendship benches, again, creating more spaces to bring out people and for them to be able to interact and just connect socially, where they can check up on each other, where we can relate to each other. I feel like those would be a few things, and being kind to yourself as well, and whenever you need, asking the people around you if they're okay or how they are doing, simple questions, and or just trying to reach out if you can. So I feel like it starts there. The first step that we need to take is about creating awareness, educating the people around us, and making sure that people around us are okay, and making it a part of our general conversation.
Thank you so much, Dalia, for being with us today, and thank you for all that you are doing as a mental health advocate. And maybe last but not least, I would go back to Doha, as now we have the sound sorted. So I just want to pass that there are questions and interests how the friendship benches can be transported or created in other places. So I'm positive that your legacy will live on beyond the World Cup this year. But also, for the closing, what would be your message for our viewers, how to keep up good mental health through sports and physical activity?
Yes, please stay physically active. And it is no cost. It's very cheap. You can simply walk. You can stay connected. We have to check our friends, our family. Are you okay? Thank you.
So, and as far as how we make sure there's a legacy from the benches, as I said earlier, every bench represents one of the countries who will be competing in the World Cup. And when we launch later, we'll be talking to ambassadors and ministers and encouraging every country to consider having a similar symbol in their country, inviting people to simply spend time with one another, take care of one another, and ask people, are you okay?
Thank you so much for being with us today and for also launching this initiative on World Mental Health Day. I would also like to thank to all our viewers from Nigeria, France, the UK, Spain, Sweden, Guyana, Netherlands, Indonesia, Ghana, South Africa, India, Bangladesh, Oman, Yemen, Australia, Thailand, Sri Lanka, Canada, the US, Mexico, Brazil, Argentina, Belgium, Greece, Bangladesh, Nepal, Singapore, Cameroon, and many others. Thank you for your questions. And also, maybe you don't have a friendship bench like the ones in Qatar in your town yet, but you can use bench in your park, at your home, and any other place to talk to someone you trust or to encourage someone who you care about and you're worried about to talk to you and seek help. Thank you so much. Happy World Mental Health Day today, and please continue following us on our social media channels and share the content that we are posting across our channels. That may be helpful for someone who is following you or part of your community. Thank you so much, and goodbye.